Right. A very good evening, all of you. Welcome to day two of our dinner session. So, I hope you guys are all ready. And we have, of course, our cutest host, Toffee, not me, Toffee, alongside, who is eagerly looking forward to attend this discussion. So, I hope you guys are all ready. So, let's go ahead with our case based discussion as soon as possible. But before that, we ended last session or yesterday's dinner session with a query. What is gallbladder kidney or what is gallbladder hypertension? Some of you have come through mail with your answers, and I really appreciate your enthusiasm. So we'll start with that question. We'll discuss some interesting facts, right? And then we'll move ahead with our today's case-based query, right? I hope it's all streaming fine. And let me know if you have any issues with audio or video. So let's go ahead. So day two of our 7-day challenge. This morning we had meditated for 10 minutes, and also we discussed about various vaccines which are available currently in our country, including the upcoming vaccines, intranasal vaccine as well as ZyCoV-D, which is plasmid DNA based on which we had a question in our updates group as well for all of you. I think around one third of you answered it right. Even if you're wrong, don't worry, because each and every source is an opportunity for you to learn. It can be a video, it can be text, it can be literature review, or it can be an MCQ, right? So you can refer to today's 5 a.m. Video if you're interested to know more about candidate vaccines which are available against COVID-19. So first, this is something which I'm really looking forward to, some interesting review in regard to Sir Harry Goldblatt. We can see a dog in this illustration, and this is Dr. Harry Goldblatt. In fact, has done some experiments on dogs. And in one of the articles, which I think some of you have seen already via Google, it's clearly mentioned that a little help from man's best friend. He is, in fact, the first person to come up with an animal model and linked up kidneys with blood pressure regulation or hypertension for that matter. Thanks to his efforts, later researchers could come up with strategies to treat chronic hypertension. So how did it all happen? Let's look into some literature now. So as you can see, we'll keep this illustration and simultaneously review the information given in Journal of Experimental Medicine, which I think some of you have already reviewed. So in 1934, a pathologist, Harry Goldblatt, established the first animal model of hypertension. So this model provided researchers with tools to delineate the renin angiotensin system of blood pressure control and eventually to design enzyme inhibitors for treatment of chronic hypertension. So as early as the mid-19th century, physicians had noted that patients with kidney disease and those with long-term high blood pressure both had enlarged heart muscles. The first clue to this kidney hypertension connection came from physiologists Robert Tigerstedt and Per Bergman, who injected kidney extracts into rabbits, thus triggering a dramatic rise in blood pressure. So, what's that extract? So, we'll get back to that in a few moments. In a prophetic explanation, I mean, they had no science backing way back then, but in a prophetic explanation, they suggested that kidneys produced a soluble protein which is responsible for this rise in blood pressure, which is later discovered to be renin, R-E-N-I-N. So a little help from man's best friend, or woman's or human's best friend, the dog. So what's this picture all about? Decades later, the duo's results prompted attempts to provoke hypertension by stressing or injuring the kidneys of animals. So they're trying to find out the link between kidneys and hypertension, if there is any. So none were successful until Harry Goldblatt, the picture you can see on the screen, arrived on the scene. Goldblatt had noted a characteristic narrowing of renal blood vessels in patients who had died of hypertension. So with his observation, he came up with this idea. So he reasoned that a decreased blood flow and thus oxygen supply to kidneys, that is ischemia, might somehow trigger hypertension. In fact, we have seen one of the images of kidney atrophy. I mentioned it as gallbladder kidney, right? So ischemia leading to decreased size of the organ. To test this idea, Goldblatt partially constricted the major renal arteries of dogs using a self-styled adjustable silver clamp. Partial constriction of both renal arteries resulted in a reproducible and persistent rise in blood pressure in the absence of overt renal failure. Clamping other large arteries like splenic or femoral had no effect, indicating that hypertension resulted specifically from kidney ischemia. So this is one of the important findings. Goldblatt published these results in 1934 in this very same journal, that is Journal of Experimental Medicine. And Goldblatt's explanation for his results was similar to that of previous physiologists' prophetic explanation. That is, there is some internal secretion that is responsible for rise in hypertension, internal secretion from kidneys, which is responsible for rise in hypertension, a rise in blood pressure. So what is this internal secretion? So years later, they discovered this to be renin. And also they discovered that it's not renin as such which is responsible for this. We have this renin-angiotensin mechanism where renin converts angiotensinogen to angiotensin. And then we have this ACE converting enzyme which converts angiotensin 1 to 2, you know all the story, right? So they could finally come up with this, clear-cut renin-angiotensin mechanism based on which they devised drugs, enzyme inhibitors, ACE and enzyme inhibitors, which we're all familiar with, for treatment of chronic hypertension. So this is a very interesting article, just one page. It's more or less like a review, a very short review. You can go through it in your free time. I'll share the link in the description part of the video. Also for the previous videos, check out the description part. Within 24 to 48 hours, we're updating important links where you can go through those links and find out additional information, right? So this is about gallbladder hypertension, gallbladder kidney. Also, you can find relevant information in Same Lingam or any physiology textbook, okay? I hope it's clear. Now, let's move on to our case-based question. But before that, look into this image. Look into the year. It's March 2nd, 1964. Okay. So this is a case-based question for today. A patient in general surgery ward was treated with hyperbaric oxygen, HPO. Which of the following may not be the diagnosis? So we'll reduce the words. In fact, this question was given by one of our team members, Dr. Hanisha. So, carbon monoxide poisoning, gas gangrene, air embolism, all or none. So, which of the following may not be the diagnosis? So, in simple words, what are the indications for hyperbaric oxygen therapy, right? So, that we're trying to pose it in the form of a case-based question. So, here, as you can see, two key words again. One is hyperbaric oxygen, and which is not the diagnosis. So, in which conditions do you go for this hyperbaric oxygen therapy? So, before you answer, feel free to answer, but before you answer, let's review some information relevant to hyperbaric oxygen, including the mechanism of action, right, in brief. So, for that, we'll use our virtual whiteboard because I've been getting positive feedback regarding the same. So even though it's a test for my typing skills, I'm absolutely fine with it. In fact, I enjoy typing, right? So we'll shift our window. We'll make some notes. Simultaneously, you can make notes along with me. And then we'll get back to this question. And you guys can, of course, answer, right? Here you have your whiteboard. Yes. We'll start from top left so that we can utilize maximum space possible. So first of all, for sake of convenience, I'm using short words, HVO, not talking about home box office. Of course, we're talking about hyperbaric oxygen therapy, okay? I mean, you can consider it otherwise, but any therapy is fine as long as you're doing good. So HPO therapy. So first of all, what does it mean? Hyperbaric oxygen, where oxygen is being delivered at elevated pressures, so that there is increase in dissolution of oxygen in plasma. It's as simple as it appears. So why are we doing this? So obviously to increase the oxygen levels in your blood to treat various situations or conditions. In fact, it is proven fact that elevated oxygen levels has several therapeutic benefits, which we're going to see now. So hyperbaric oxygen is administered to patients. Yes, of course, air embolism, we'll get back to that as well, because this hyperbaric oxygen is known to reduce the size of the bubbles, which is very, very interesting. We'll also deal with some loss of chemistry, which we dealt way back in a plus 1 and plus 2. So first of all, hyperbaric oxygen is administered to patients when their own hemoglobin is unable to carry oxygen, adequate oxygen, or when hyperoxia is required, as mentioned in Manipal Manual of Surgery. So hyperbaric oxygen is administered using either a monoplace or a multiplace compression chambers. In fact, what you're seeing in the slide is a monoplace. It's for single patient. I hope you observed it properly. Again, we'll get back to that, don't worry. So what are various indications of hyperbaric oxygen therapy? So indications. Yeah, so first, we'll go based on the information given in the textbook, and then we'll also move on to additional information given in the articles. The links will be posted in the description part for your convenience. So carbon monoxide poisoning. So this helps in, you're trying to push oxygen into the plasma at elevated pressure, which helps in displacing carbon monoxide, ultimately saves life. So hyperbaric oxygen at a pressure of 2 to 3 atmospheres is given to increase oxygen dissolved in plasma, right? Even though where there is not sufficient hemoglobin to carry, or even when hemoglobin is saturated with carbon monoxide. So in carbon monoxide poisoning, so let me just mention it as carbon monoxide or CO as per your convenience. Also, it's indicated in treating infections, especially the interesting thing is it is effective against anaerobic infections. So hence it's used in treating gangrenes as well. So we can just mention it as infections such as gangrene. Yes, Trophy, how can I help you? Actually, there is lightning and thunderstorms we're facing right now. So Toffee seems to be a bit worried. Okay, Toffee, you can join us on table. Yeah, please sit down. Sit down. No, don't disturb now. And also in case of cancer therapy, which is known to potentiate radiotherapy, this hyperbaric oxygen, right? In cancer therapy, as it potentiates radiotherapy. Also, as some of you are already mentioning, yes, 2 to 3 atmospheric pressure, good Danish. In case of air embolism, in case of decompression sickness, right? And also, we have some additional indications, wound healing, right? So rather we can say its uses, right? Wound healing, plastic surgeries, there are a wide range of applications, right? Wound healing, crush injuries, okay, more or less the same. Compartment syndrome, which we dealt with in general surgery, if you remember. Yeah, compartment syndrome. Flap salvage. And even in case of anemia, when there is blood loss, even when there is no hemoglobin, we can use this therapy to pump in oxygen, which is required. So acute blood loss, anemia, and so on, right? So various indications or uses of this hyperbaric oxygen therapy. Now, let's keep these indications here. Let me see if I can highlight indications in a different color. Oh, everything seems to be changing. Right, so black is best, black and white combination. Now, keeping these indications in mind, I'm sure you can answer the question now, but before we go ahead with the question, let's also look into the mechanism of action, which is very interesting, as I mentioned previously. So we'll mention the same here. So what's the mechanism of action? So we have primary mechanism and secondary mechanisms mentioned in various review articles. So we'll just try to outline them for your convenience, right? So primary mechanism of action is through hyperoxygenation, because when you're delivering oxygen at elevated pressure, the level of oxygen in plasma which is being dissolved is enhanced. So basically you're pumping more oxygen, hyperoxygenation, and decrease in bubble size, which is understood because that's the reason why it's indicated in case of air embolism, right? So the primary mechanism of actions are hyperoxygenation and decrease in bubble size. Let's look into secondary or miscellaneous effects of this hyperbaric oxygen therapy. The secondary mechanisms include vasoconstriction. Carefully note down these points because I'm going to leave this session with some unanswered questions, and this is going to help you answer those unanswered questions, right? So vasoconstriction, angiogenesis, fibroblast proliferation, wound healing for that matter, right? I'm sure you're getting the hints. Leukocyte oxidative killing, toxin inhibition, and interestingly, even antibiotic synergy. Okay, so let me just select this, drag this so that it looks aesthetic, right? So this is the mechanism of action. Okay, so primary mechanism of action is through hyperoxygenation and decrease in bubble size. It's based on some chemical laws of chemistry. So let me just mention them here, and it's up to you to let me know what those laws are all about. So hyperoxygenation is based on Henry's law. Okay, that's it. I'm not going to speak any word extra. Henry's law. So it's up to you to find out what Henry's law is all about. And also this decrease in bubble size is possible because of Boyle's law. I'm sure you know these laws. You might have come across these laws in your +1, +2 chemistry, physical chemistry. So hyperoxygenation and decrease in bubble size. So these are the primary mechanism of actions. And then we have the secondary mechanism of actions, which include vasoconstriction, angiogenesis, fibroblast proliferation, leukocyte oxidative killing, toxin inhibition, antibiotic synergy. Okay, so just keep these mechanism of actions in mind. And also these are the indications, as you can see to the left of your screen: carbon monoxide poisoning, infections, cancer therapy, air embolism, decompression sickness, wound healing, in case of acute blood loss, right? So these are some of the things which I wanted to highlight. And before we shift our slides, let's conclude with this. So when I was in high school, I used to be a fan of all these drawings. We used to do all these paintings, take a printout, post names of our friends and tease them. That used to be a very interesting exercise. Yes. Okay. I hope you made a note of this point simultaneously. Now let's move on to our presentation once again, where I'm sure you will be answering the question. So as I mentioned previously, so you can see a single chamber, a mono chamber. Also we have multi-chambers for treating multiple patients simultaneously, right? So if you look into the question once again, a patient in general surgery ward, was treated with hyperbaric oxygen, which of the following may not be the diagnosis? And now the answer must be clear. So all of these are indicated. We go for hyperoxygen therapy in all of these conditions. So which is not the diagnosis? Option E is right answer. Okay. Fantastic. So these are some of the topics which I wanted to highlight. And before I leave, I have the following questions for you. What is Henry's law and what is Boyle's law, based on which we have seen the primary mechanisms of action? Try finding out, it's very interesting. And also, you've seen secondary mechanism of actions, right? So related to that, I have the following questions. How does hyperbaric oxygen therapy help in wound healing, angiogenesis, and why do you consider this hyperbaric oxygen bactericidal? So in fact, I have 5 questions for you, which can be grouped as one, all related to hyperbaric oxygen. So what is Henry's law and Boyle's law? And also, how does hyperbaric oxygen help in wound healing, angiogenesis, part and parcel of wound healing, and also how is it or why is it bactericidal? Because we have seen that hyperbaric oxygen eliminates toxins, is effective against bacteria, especially anaerobes. So what's the mechanism behind that? If you can dig a bit deeper, right, it will help you remember in a much better way, and that's the objective of giving these questions, right? So also, before I conclude, let me just highlight one point which Danish already mentioned previously. So usually normal atmospheric pressure is 1. So hyperbaric oxygen, where the pressure ranges 2 to 3 atmospheres, leads to dissolution or presence of 6 ml of oxygen being dissolved per 100 ml of plasma, right? Usually at 1 atmospheric pressure, the amount of oxygen that's dissolved in plasma is 0.3 ml per deciliter. It's only 0.3 ml per deciliter at 1 atmospheric pressure, the amount of oxygen. At 2 to 3 atmospheric pressures, it is 5 to 6 ml per deciliter. Okay, Toffee is giving me a signal and she's directly telling me on face that I have to stop this session and not extend it further, because according to Toffee, the average focus time is only 15 to 20 minutes. So she's asking me, why are you conducting this session for around 40 and 45 minutes and troubling all these wonderful, intelligent aspirants? I'm really sorry, Toffee. I'm just trying to pass time, you know? Okay, guys. So it was lovely interacting with you, and I really appreciate your enthusiasm for finding out what gallbladder kidney is. We have seen some interesting information about the same. Try finding out these questions, and don't wait for me to answer these questions. I want your active participation, which is the key to learning, which is key to success. Right? So try finding out all those questions. Get back through mail. We'll definitely, in fact, we tried answering all your mails till this morning. So give us at least 24 to 48 hours. We'll get back to you with all relevant information, and also whatever additional resources I have been citing, you can check them in the description part of this video after 24 to 48 hours. By the time we'll be completing the processing of this video. Okay. Yes. Hi Vaishnavi, glad to hear from you. That's really good to hear. The positiveness, the secret is Toffee. It has nothing to do with me. Okay, Toffee? Happy? Say bye to everyone. Oh, do you want me to check the comments? Sure, why not? So before we conclude, let's check the comments and then we'll say good night. It's just 8:30. Hi Hrishikesh, a very good evening. Hi Rinza, hi Kritika, hi Dipanjan, Sohini, Vaishak, Devi, Krishna, Twinkle, Aisha, Sathivia, hi Sohini, hi Kritika. Twinkle, when will this start? Usually 8 p.m. IST. Dinner sessions start at 8 p.m. Our 5 a.m. club starts at 5 a.m. Indian Standard Time. Toffee, you're getting so many good evenings. Hi Monica. Hi Pooja. Hi Vipul. Hi Shivangi. Nikita, Swati. I see most of you retracting your messages. It's absolutely fine, even if you're wrong. It's absolutely fine. We're all in different levels of learning, and consider, as I said, every opportunity, every resource has an opportunity to learn. Hi Pooja. And yes, Rathor, Sefali, Harita. Yes, Danish seems to be answering about Henry's law. Very good. So anyways, get back through mail, guys. We'll provide you more information, right? We'll also analyze your work. Vaishnavi. Yes, Vaishnavi, oh, very good evening. Hi, Kushbu. Okay, guys, take care. Yeah. Bye. Say bye.